business of the people. We ask for your guidance and your direction. In Jesus' name we pray.
Amen. Ms. Shelley, will you call the roll for us, please?
Nell Fulbright,
Present.
Dick Lane,
Here.
Jack Baker,
Here.
Harley Buzzard,
Here.
Joe Bird,
Honey.
Julia Coates,
Here.
Jody Fishenhunt, John Garvin, Anna Glory Jordan,
Present.
Frankie Hargis,
Present.
Lee Keener,
Honey.
Curtis Snell,
Here.
Janice Taylor, David Thornton, Victoria Vesquez, David Walkingston,
Honey.
Kara Cowan Watts.
Honey.
We do have a quorum.
Thank you. If everyone's had a chance to look at the minutes, I will entertain a motion for their approval.
So moved.
Second.
We had a move and a second. All in favor of approval, please say aye.
Aye.
The report is approved. Moving right on down to the Claremore, Mr. George Valuers.
Good afternoon. I think my report made it in there. There's a couple of changes on it. They're put in there that the chiropractic clinic is stopping. We didn't stop that. We ran some new numbers on collections for that. We're going to go ahead and extend it another 6 months to see how it works out for the full year, for a full cycle of collections. So the chiropractic clinic will run through the end of October. We're having good luck with it. The doc is averaging 41 patients a day. The patients, I've gotten several letters that they've really had some good luck with pain management and things from him. So it's kind of a win that the collections are going to work out too. MRI, it's installed. They're finishing up right now. We are the X-ray tech that she's in San Diego as we speak, being trained. We're going to start putting patients in it May 19th. We're scheduled to start doing patients. We went backwards a month. Picked up those that were denied last month, and we've started scheduling those from day one, so that we'll have a full load of patients to go in and give her, different things to train with, different patients to train on. So Toshiba will be there with her hands on while she trains a couple weeks on our machine, and that should start May 19th. Outpatients are down. Collections are down. A lot of that's attributed to a backlog in coding. We're working on that, trying to get that backlog down. Any questions, ma'am?
Yes. Go right ahead.
Thank you, Madam Chair. George, thank you for the updates too. On the CHS money, have you been given numbers for contract health service if we compact it from the Cherokee Nation?
The only number I got was that I received was the 3.6 million.
3.6 million? And what is your total overall CHS money?
Just over 10 million.
Do what now? I can't hear you.
Oh, I'm sorry, just over 10 million.
10 million?
I couldn't hear the question.
I couldn't hear the question.
So my question was, has George been provided with the amount of money that we potentially could compact from Claremore for Cherokee Nation out of the contract health service dollars? His response was 3.6 million approximately. And then I asked what his overall budget was, and he said it was a little over 10 million for contract health service out of Claremore.
Thank you.
And that's my only question for you. Thank you very much, George. Thank you, Madam Chair.
Yes. Councilor Vasquez.
Thank you, Madam Chair. George, I just wanted to make a statement about the chiropractic care, and I was going to ask why did it stop, and I'm glad that you're extending it till October, but I was going to ask what happens then at the end of October?
If it's still successful, because of the size of the practice, we will have to put it out for bid and to continue that. We have been contacted by several, actually many chiropractors, several there in Claremore who are Cherokee Nation members, and that would stated they would be interested in partnering with us to do for that practice. So at the end of the year, that contract is up with this doctor, and we'll put it out for bid.
Good. Thank you.
You're welcome.
Any other questions?
Yes, I had one.
Go right ahead.
You just answered my question about the chiropractor stoppage there, George, but I want to go back to Councilor Watts' question about contract health. Have we implemented the contract yet? Has that money been
No, sir.
moved to the nation?
No, sir.
Do you know why it hadn't been done?
No, sir.
Maybe-
That's an area that comes from Oklahoma City.
Connie, have we, know why we haven't done that yet?
I have an update in my report on that very subject. It's getting ready to happen June 1st,
When?
June of this year.
Oh, June the 1st,
Yes.
okay. Okay, thank you.
Councilman Keener, did you have a question?
Yes, thank you, Madam Chair. On the chiropractic care, will that be sole source to one or two chiropractors in October if you decide to continue?
If we bid it out, I can see it just being awarded to one doctor.
Thank you. Thank you, Madam Chair.
We have any other questions from Mr. Valiers? All right, thank you for
Thank
that
you.
good report. Next, Ms. Connie Davis, Cherokee Nation Health Services Director.
Thank you.
Good afternoon.
Afternoon. The thing I'd like to begin with today is last month we had our accreditation survey by DNV. They spent 3 days looking at our hospitals and a couple of the clinics. And I asked the staff at the exit interview to just record it, and because I think sometimes it doesn't mean as much if I repeat something, because, you know, we want to tell you all the good and don't want to have to address the bad sometimes, but I thought it'd be nice if you guys heard directly from the surveyor's mouth their opinion of the evaluation of our health system. So it's a short video. If you don't mind, I'd like to show it, and then I'll conclude my report and entertain questions.
For those of you who don't know me, I was here last year. I'm Tony Proctor. I serve as your ED. What? Can you hear me? What? All right. I'm still in here. For those of you who don't know me, I'm Kelly Proctor. I served as your lead this year, and I served as the physical environment person. And this is my second year here, and I thoroughly enjoyed it. It was wonderful last year. It was even better this year because I got to see all the things that you have done over the last year, especially correcting your nonconformities from the year before. It was an excellent survey. I will go over a few things, and each one of us will talk. I'll explain a few things once we get done. But before we get going, I wanted to give you an update on your nonconformities from last year. We reviewed every one of those, went over them, and it's kind of amazing. We closed out every single one of those. That's not always the case. We expect sometimes that things are going to be left open just because it takes a while to do stuff. It was amazing to see the corrective actions that you put together and you followed through. So before we get going on everything, like I said, when I get down, I'll give you an update on what goes from here. Does everyone in the room understand how the nonconformities work? Do I need to repeat them? You want me to repeat them? Okay. So if you got any questions while we're talking, just interrupt us and ask us. It's okay. We'll answer any questions you got. Okay. All right. Well, we're going to start with
Well, I want to reiterate everything that Kelly just said. I'm so proud to be back, very honored to be back. And I want to thank everyone for all the help that they did very much for going out and about. And I truly feel like I was back at home. And please thank all the elders that also donated their time to us. So we really appreciate it. I'm so proud that we closed all the clinical bondage last year. And we only have 2 clinical bondage for this year. Very minor non-conformances. I actually almost felt guilty about even writing them. But the first one is going to be relative to medical records. It's MR.5, and it is due to dating and timing. Out of the 17 medical records we have, I think we had 4 or 5 of them, but the EDT sheets are still lacking the date and time of physician signatures. So it's an NC2 for there. And the next one is going to be relative to surgical services. That is an XS.8 to the immediate post-operative note. When the surgeons are putting in whether the patient has a graft or an implant, they are checking that. But there are improvements back to where that implant is. So it's an NC2 because Mary, I think, had 3 that the implant sticker was actually on the immediate post-operative note. And I had 2 or 3 that they were using the inventory form. So there wasn't any improvements between the inventory form that the surgeon looked at that form and validated that that was the implant. So that's an NC2. We did have one in infection prevention that we were kind of talked a lot about and investigated a lot about out at the dental clinic yesterday about the fans on the end counter sterilizers that were corroded with some dirt and grime. And so we're just making that an opportunity for improvement because overall, system-wide, there was not any infection control issues at all. And I want to do a noteworthy effort again, Jennifer and the rest of the team in doing infection prevention and working very proactively within the system itself to make our people better. So y'all have any questions for me?
My name is Mary, for those of you I haven't met, and I am new to DMV and was on survey with Lois, and I just want to thank you for having us. I really felt very welcome, and it's a great crowd here, so thank you so much.
My name is Mike Jessa, and I was generally surveillance. Basically, I looked at many things, and part of what I did was close out some classes that were in my area, and tried to see if I could find any NCs this year. The news is I couldn't. I was very impressed with everything that you're doing here. I'd like to thank all of you for a really great experience. I spent most of my time with Ginger, so I'd single her out because she's incredible. But she's not, I just say that because I say it because she is, but also because I spent most of my time with her. But everybody I came in contact with understands what you do here, why it's important to understand, get the quality improvement philosophy, part of your culture. It's really impressive, so I appreciate that. And you should be very pleased with what you're doing because it's working. Thank you.
Any questions for Mike? I would like to say, I'm coming up on, this is around 175 surveys I've done with you. And I can count on one hand how many times we've had 0 non-conformities involved. Nice job. Very nice. Very well done. Follow the lead of the quality department's done a lot of had a big non-conformity last year in biomedical. And I followed up on that this morning. And you guys done an incredible job closing that up. Still got a little way to go to get to where you want to be, but you'll always have that. Say your team's doing a good job on it, so congratulations, because I had no expectation of closing that down. It was a big non-conformity, there was a lot of work to do. You kicked it and you got it, so nice job, nice job. Couple of things real quick before we go over the non-conformities that I have. Everyone that I was with this week, was great. Everyone was transparent. We talked, we had some good open discussion. We talked about a lot of different things, and your safety department, your plant operations department, your biomed team, everyone that I interacted with was very open and willing to go the extra mile to make things right at this hospital. And that's nice to see. A lot of times you don't see that in the support services area because they just don't, they're not used to that. They're not used to having they're not used to being able to be open and going like that. So it's nice to see. And I was picked on a lot, but I can take it, and I look forward to doing it next year. One thing about all those folks that I interacted with is every single one of them had a ton of pride in what they're doing. And when you have pride in your work, you have nowhere to give it up. It's always going to be better. There wasn't one single person who I heard complain about this hospital, its leadership, and what they do. And I'm going to tell you, we have people say, "Why am I boss?" and stuff like that. We didn't get that here. Everyone is proud to work here, and that's a lot. It's a real pleasure to be with you guys. On with my non-conformities. I have a non-conformity in my state. That is simply having the paperwork for your viral worm tested, detailed to show that the things they tested passed or failed, and if it was really a test. It was very few items on there. You got hundreds of things you're checking, but there's just a few little items you couldn't determine if it was tested and if it passed or failed. I know what the intention was on it, but you just don't have that documentation for it. And the second thing on there is the dental office has a lot of items stored in the hallway, and it's narrowed the egress down pretty slim in some areas. So that kind of needs to be cleaned up a little bit and get that straightened out. That's it under life safety. So that's an NC2 and easy to fix. The next one I have is under utilities management. That's just getting your documentation straightened out on your generators. You're doing all the right tests, you're looking at all the right things, but you got to have good, clear evidence on your documentation that you're doing that. So give yourselves credit for it. All you got to do is give yourselves credit. You're doing everything else, so just write it down and say you did. And that's it on the generators. Under that same non-conformity will be getting your medical gas inspections caught up to date. I didn't see evidence of that yet, unless you guys know. Okay, and that's it. Just getting that medical gas inspection caught up, and that's it. So 2 non-conformities on the physical environment side of things. Very good. And NC2 is both of them. Any questions on that? That's a pretty good survey. I really expected it. All right. So that's a total of 4 NCs of this survey, and they're all 2.
All twos.
That was it, right from the horse's mouth. So I think all of the clinic staff, from the groundskeepers to the registration, to the nurses and the physicians, they share in how well we do and how well we deliver care. And I think they should all be commended for a job well done. The first year we had our survey, we had 32 nonconformities. And so to clean those all up and only have 4 this year, I'm really proud of the staff and their commitment to making sure our quality is what it should be. All right, in the month of April, besides the survey, Wilma P. Mankiller saw 9,611 patients. Redbird Smith, 9,330. Salina, 7,890. Jay, 6,660. Nowata, 4,336. Muskogee, 12,609. Bartlesville, 1,997. Bonita, 5,619. Gadugi Clinic, 331. And Hastings, 26,045. And it continues, diabetes continues to be over 51% of our patient visits. I think another thing that I wanted to share with you out of this report is we try to monitor the time patients spend in clinics, because we hear about long wait times and it's all-day event to go to the doctor. And through the efforts of our improvement, Veneta reported their new cycle time. They had a goal of 45 minutes. That's toes in the clinic to toes out, and they're at 44 minutes. So Elton and their group should be commended for a job well done in that. You've heard us speak about our family practice residency under the leadership of Dr. Doug Nolan, and these are students from OSU. We've recruited several of those providers, and out of the first class, we've recruited at least 2 this round, more than this, but the ones I'm reporting today, Dr. Dustin Beck and Dr. Amanda Bighorse both passed their family practice residency board exam, so that's a great job. So, and Dr. Doug Nolan, of course, should be committed in that as well. In the emergency room and the urgent care, we saw 5,495 patients and had a left without being seen rate of 3.15. So we've been hovering around 7 and 8%, and you hear me harp on this, and that's the national standard, and we are right there. So that stuff, we look at those numbers every day. Brian meets with them every week, along with Dr. Franklin and Dr. Nolan, and work on ways to improve the process and the flow through the ER. Surgical services performed 336 cases. The dental service saw 1,797 new patients in our health system. 803 sealants were placed on children, and 985 children had fluoride treatments. And we've offered a letter of intent on another pediatric dentist we hope to put in the northern clinics. So that'll be a new service to offer there. Behavioral health saw 1,299. Jack Brown has 20 patients with 12 waiting, and we're hoping to have the groundbreaking for that new center in June, we're hoping. And the pharmacy filled 157,000 prescriptions, plus 13,000 of those were 90-day prescription refills. Our PACE program has currently enrolled 130 participants, so that place stays busy. And to follow up on a question by Counselor Buzzard, we finally got our letter back from area office on the negotiations for contracting Craig County and Rogers and North Tulsa County CHS. And in total, it is $3,686,000. And June 1, we will begin full assumption and operation of that contract health budget. So we're looking forward to that. And just to also update you on an email I got today, not to create panic, but just to keep you informed, to let you know that we are staying as informed. The CDC is going to put out another press release on this Middle East Respiratory Syndrome virus. It's called MERS, and it's cold and flu-like symptoms, pneumonia-like symptoms, has a 50% fatality rate. And so we're keeping as updated and educated in monitoring and tracking that potential crisis with our patient population as well. That's all I have to report. Do you have questions?
Counselor Lay?
Thank you, ma'am. The So June 1st, you're going to start the outpatient for the Claremore area.
Yes.
And that, I guess that's permanent, and we're taking that over permanently.
Yes.
We're getting the funding, will they be all at once, or will that funding be staged down?
How that will
Because
happen?
we're starting June 1, we'll get a third of it. This year, we'll get the remainder the next, and then it'll be ours in our budget fully at that point.
Great job, thank you, guys.
Anyone else? Counselor Watts?
Okay, thank you, Madam Chair. So is it inpatient and outpatient, or simply outpatient for those 3 counties?
Outpatient.
Inside the- Okay, so it's only outpatient, so inpatient is still an issue, that it is still gonna go through Claremore IHS?
Yes.
Okay. And you said 3 points, clarify the number again? And it's only for Cherokee Nation citizens in Craig, Rogers, and North Tulsa for outpatient CHS, not inpatient.
Right.
Craig
Craig County's all
It's
natives.
already
right?
inpatient?
Craig's all Indians, not just Cherokee citizens.
But the North Tulsa, I've got to be able to explain this. So North Tulsa and Rogers is Cherokee Nation citizens only for outpatient, but not inpatient.
Right.
CHS. Craig County will be all federally recognized tribal citizens for both inpatient and outpatient?
Outpatient only.
Outpatient only. Just got even more complicated. I mean, it's a good complication because it means we're going to be able to serve better. So will we put a CHS staff person in Claremore, or how are we going to address that? Will we have additional staff here in Tahlequah, or both?
We're working on the logistics of, using maybe some staff that are still there, and we assume the responsibility of that staff. So that's something that Brett and Dr. Grimm and I will work out in the next week or 2.
And will you provide that to us in writing so that we can inform our constituents
Sure.
about what the procedures and process and policies are, and updated maps as well?
Yes.
Okay.
Sure.
So, what, on the 5% dividend, I tried to look through the report, and maybe I missed it, so if you can point it out to me, but the amount of CHS money left in this fiscal year, where are we at on spend for the 5% dividend?
I don't know if it's reported in here. I don't think we report, like a balance in the bank. I don't think we report that.
Can we get that added to the report and get an understanding? Because I thought other council people had even asked about that, but maybe, because I was trying to get an idea of where we were at, especially in the context of the new CHS compacting that we're taking on.
Okay.
There were a number of items in the meeting minutes of things we asked for, but I know, and it wasn't just me that had asked for things. One of the things I'd asked for was a handout explaining the process in regards to palladium. And unless I missed it, I haven't received that from last month.
I think we are working with their staff on getting something like that developed.
Okay, and will you update us before the next meeting so that we have an understanding of where that's at?
Yes.
And then I had asked about the recruitment report stating if they're Cherokee or not. Some places it does, but some places it doesn't. And I think maybe, is it consistent yet, or?
It's not, and we actually did meet about that this past week and are working on some changes to improve that and focus our efforts where we know our Cherokees are graduating school.
Okay, and then I'd asked for a idea of where we were at financially on our facilities with both existing as well as consumption rate, meaning usage, such as the Hastings hospital beds being used as inpatient per number, and we haven't seen anything like a
I don't remember
global
that
look.
question, so I'll have to go back and watch the video and.
Yes. And then I think there was a request for mental health needs, which didn't come from me, on where we were at with the mental health report. And then the other thing that I don't think was in there, but I'd asked about consistently, is the pending follow-up denied on contract health service. Have we come to a resolution on how to report those?
We have not. It's just hard to track it because of our system. We're just limited on how we can extract that data.
I guess maybe another way to look at it is, it may be difficult to follow the actual pending, because some of those may take some time. They're gonna be complicated potentially. But maybe we can report, we'll know if we ended up denying some of those pending.
I think in effective June 1st, that would be a lot cleaner.
Okay.
Much more understanding, because it won't be two separate systems trying to carry that out.
Okay,
So that's, I'll sleep better now.
very good. That means I'll get to sleep better at night too, so thank you. So then, I think to clarify on the $100 million plan and where we're at on a global perspective, I had questions about how are we paying for it? Will we have to pay back? Because I think the news reported, I didn't get to go to the CNB meeting, but that we'd added additional money to the whole overall project. You know, what does the scope of our spending look like in terms of the health expansions? And then the equipment and services, are we expanding new services, new equipment, and what's the staffing plan? I still haven't seen anything in writing, I guess. Have I missed that somewhere?
I don't know that you've missed it anywhere, but we can, the scope of services I asked to be sent to you, so maybe it didn't
I
get
don't
sent.
recall.
Okay, it may have not.
So-
I will follow up with who I
Thank
asked,
you.
and
And the meeting minutes too.
okay.
Thank you, Madam Chair.
Counselor Fisher-Call?
Yeah, Connie, I'm thankful you showed us the film, and I think you're doing a good job with health. I was glad to hear that we'd added 1,800 new patients into our dental system. You know, it's the first time you showed us last couple of months that dental was making money and generating revenue. I think Dr. Jones has done a wonderful job. I know Dr. Montgomery, I'm looking right now at the vacancies, he's running the hospital, and him and Dr. Nolan, and they're filling vacancies in providers. Thank you, Dr. Grimm, for attacking the problem up at Claremore. We're chiseling away at that problem. That's something that should have been done years ago and wasn't. I appreciate that. I know Brett's been working hard on the Claremore. I know we've put a lot on you and asked for a lot of details and statistics on our contract health problems, and you're working away with that. And I know George back there has been working on the MRI machine, so I'd like to give you all a hand. Y'all's doing really good, considering you was thrown into the mix a couple of years ago. In fact, a large problem. You're doing a great job.
Thank you. Appreciate the support of the council and of course the chief.
Counselor Hargis?
Connie, do we have or offer chiropractic care at Hastings?
Palladian, it's not at Hastings physically, but through Palladian, there are chiropractic services available.
Thank you.
Anyone else? Counselor Keener?
Thank you, Madam Chair. I guess most of my questions have been answered, but I was going to go back to the outpatient care at Claremore. And so for a patient coming in now, things should be much easier now, starting June 1, as far as their approval, right?
That is absolutely our goal.
That's the goal, right?
Yes.
So that's really good to hear. And then there will be, we talked about staff being there to help out. How are they going to get the word out to the patient themselves when they go see the doc? And is he going to refer them to the staff, or
I think it's
how will
an
they know?
internal process more than anything. And ideally, we will have staff physically located at that site so that nothing in their eyes changes except to expedite the referral process and the approval process and the appointment time.
And then the 3.6, that's designated for Cherokee. So
Except in Craig County.
in Craig County, yes. Then will that be? I guess I'm trying to get a picture of what that will look like, how far that will go toward the health care. Do you have any feeling for that?
We feel like we can comfortably assume the outpatient services on that budget of those counties.
Okay. Very good. Thanks a lot for doing that. I know last month it was a little bit touch and go. We didn't know if we were going to sign off on that.
Well, there was a debate or discussion on, it opens up the entire compact.
Right.
And so the contract support cost was a hot ticket item, and they went along with our request, so thank God we're able to get this finalized.
And George knows about this too, right?
Yes.
Okay, all right, we'll make sure. Thank you. Thank you, Madam Chair.
Speaker Jordan?
Yes, Connie, I just wanted to thank you and your staff. I know how much Graham has worked on this to make this happen. We asked you to find a way. You did find a way, and I, for one, want to thank you for it. This is a great accomplishment for the Cherokee people.
We think so too.
Was there some, Counselor Buzzard?
Yeah, and I want to echo Madam Speaker's words too, Connie. The other thing that I want to ask you about is the mental health. We're going to do a survey to see if we're going to hire any more mental health workers.
We are working very closely, Dr. Montgomery is, with our behavioral health staff to do an evaluation of the productivity, first of all, and then evaluate the need to add staff.
The other thing, and I know we talked, and I'm really glad that we talked about Palladium last committee meeting because it cleared up some things for me, but I've had one or two complaints about notifying people when they're denied on a referral. I think we talked about that and didn't know where the holdup was. Whether Palladium is actually given the denial for the referral or is it the provider? I had a person ask me the other day, well, I didn't know that I got denied. We was going to go to the appointment and he was denied. And they asked who denied him, and said, well, Palladium was denied. I guess what I'm saying is the denial process is not getting back to the patient. There may be a miscommunication between Palladium and the provider. That's what I'm getting at, or what I'm hearing.
And as you hear those things, please share those with
Sure,
us so we can address them, because we have a lot of back pain referrals, that's why we're here, and so the more specific information we have, the better we can follow up and correct those things.
And I told him, that I think it's going to get better. I think it has. The other thing, the diabetic stuff, you reported 51% of our patients were diabetic. Do you have any numbers? Have you brought that down in the last 3 or 4 years, 5 years?
Like the number of diabetics?
Yeah, you said 51% of our patients were diabetics.
I would doubt that we've brought the number down, and this is pure speculation. I don't have data to support it. The thing we can report, and I can maybe follow up next month, is how well we do controlling blood sugars, and we monitor that very closely.
That'd be interesting to see. And the other thing, us natives has a problem with diabetic, and I'm a diabetic too.
I am too.
And, that's disturbing that we can get our numbers down. I know, and I don't know what these people, what their titles are, but we have some staff members that, I don't know if they do exercise with diabetic patients, or I know they have some at Jay Clinic because I saw them there 2 years ago. Do they work with the diabetic people, or what is their job function mainly? Not only what their job description is.
Okay, I don't know specifically who you're speaking about, so I don't want to answer incorrectly.
Yeah, well, I don't find out their name, but actually there was a new program, I think it started about 3 years ago. They'd work with the WINGS program, and then they'd have a clinic for diabetics, maybe they'd have a walkathon or something like that. I'm not sure what the program is called.
Okay.
I'll
Let's check
find
and
out
see.
what the name is.
Okay.
Thank you. Thank you, Madam Chair.
Chief Burns?
Connie, I want to commend you and Dr. Graham, Dr. Montgomery, Dr. Jones, and Brett for doing really a good job in the task that you were assigned with. Due to unfortunate circumstances, I've had a friend that's been in and out of that Hastings Hospital, ICU, emergency room. I know about every room on that third floor now. Mornings, nights, I've been going up there for 2.5 months. And the attitudes of your PAs and your RNs and your doctors, they're doing an outstanding job of what they have to work with. I know we've got a long ways to go, and everyone's excited about this new facility, and I just hope we do it right. I know you're trying. We've had our meetings, the architects, and make it storm-proof and all of that. And I'm just really excited for the people on the response that I'm getting. And I get out there in the rural areas and visit with some of the traditional people that really are not very assertive in their opinion, but if you go to them, they'll let you know. So I've spent an enormous amount of time the past 3 months just seeing what their feelings of, and there's some good thoughts going on out there, and you guys are doing a good job, so keep it up.
Thank you.
Thank you, Madam Chair.
Councilor Thornton?
Yes, thank you. Connie, if you ever find a medication that'll cure diabetes and lower our numbers, I sure want the medication first. I want it before everybody else. And I don't think we're there yet.
You and my
And
daughter will be
I don't think
first.
we're going to lose any patients unless they die off from diabetes. I think, as far as that is concerned. Our contract, I'm very excited about the hospital and that we're building and the surgery center. Because I think a lot of our contract health money that we're sitting here having problems with here and there can go into that hospital and serve our people better and do more for our people right there. I've got a couple of little stories to tell. I have, of course, I've got several friends in California. One of them moved here about 6-8 months ago. And about 3 months ago, he's got a physical problem. And about 3 months ago, he called me and I said, best thing you can do is go over to Claremore because, you're so far from Hastings. So he makes a little trip over to Claremore. Took him all day to see a doctor. He said he was treated terrible over there. He said it was dirty over there. And he said when he did see the doctor, they didn't have the medication he needed. So he went back home, and the next day he went to Hastings. He said they pulled him right in, and the doctor took care of him, and he got his medication then at that day from over here at Hastings. Plus, he said even the lady that was behind the desk come out and talked to him about his medications and told him about how to take them and what to do. So, I'm really glad about that and appreciate you all very much because I know that you do a wonderful job. Thank you. And Friday evening, along about 10 o'clock, I got a text message from the person that's the curator of our Cherokee Nation Park. He said he was in lots of pain and he has a heart problem. And so I texted him back. I never did get an answer back. So a little bit later, I took off over there. And I went in the house. His house was open. Everything was on. I couldn't find him. I looked through the house and looked out in the vehicles. And I told him to go ahead on and get out of there and go to the doctor. But I found him about 30 yards off down in front of his house. And he was laying on the ground. His left arm was numb and his hand was numb. So I pulled my truck up close to him and loaded him up and took off to Hastings. I got up here at Hastings emergency room. I went in the ambulance door, which I didn't know which door was which, I see you grinning, so you know. And I went to beating on the door. It was locked. And the lady was there at the desk. She jumped up and run out there. And I told her what was happening. Well, she brought a cot out right then, a bed. And somebody helped us, and we transferred him over on the cot. And we put him in he went right into the emergency room. And the doctor was right there. It was a black lady. I didn't know her name. She really was sharp, though, I tell you that much. But the nurses and the RNs and the people there were just wonderful. And they didn't know who we were, what we were, or what we was doing. I looked like a hobo from the railroad track. But they took him right in. They put something in him. They wouldn't tell me what's going on because I'm not his kinfolks. But by the next morning, I had to go to Tulsa. So I was on my way up there, and this boy called me, and I said, "You're home?" He said, "I'm home." I said, "How's your hand, your arm?" Because I figured, he had a stroke, and he did have. And he said, "I'm moving it," said it's doing better. And then I talked to him last night and this morning, and he's doing real good. So by y'all's actions and the way that you took care of him, and of course, they put a real big needle in him, but it had to do with the stroke medication. But after that, I went back to the park and shut down everything, closed up everything, took care of him, found his phone was laying out in the bushes, and his glasses was laying out there, and I just luckily found them. But I really appreciate the way y'all handled him and took care of him, and I mean, that's first notice of everything, you know. And I appreciate it. The only problem I had, I called Cherokee County, or had them call, and asked them to meet me, an ambulance to meet me on the way up there, and they said they wouldn't dispatch one unless I stopped and pull over. And I said, I'm not stopping and pulling over. So they never did dispatch an ambulance for Cherokee County. But maybe that was better because it took less time. I was running pretty fast. And never did run onto a highway patrol, you know, look for one, you know. And, but thank you.
Thank you for sharing.
Thank you,
I
Councilman.
still have some more questions.
Oh, go ahead.
I see on your 5% that most of that 5% is spent on referrals, emergency referrals, and that's call-ins. So, you know, when you call in and it's spent on emergency referrals, then that has to go through a committee to see if that's appropriate, right? So then they may get turned down on the emergency referrals. I want to try to get that straight because I want to know where all that 5% is going. Apparently, you know, it's not going for some of the things that it was limited to eyeglasses or dentures or prosthesis or cancer treatments or hearing aids, but, you know, I can see using it for emergency referrals. Another thing is that, do the patients there at Muskogee, do they primarily go to Hastings, or if they're contract health, do they go to the hospitals there at Tulsa or wherever they're sent to a specialist?
We try to refer patients to whatever's closest to their physical address to make it convenient for the patient.
Yeah.
A lot of it, if we offer the service at Hastings, for example, there are some orthopedic services we do there at Hastings. So rather than send them away for something we could do there for a less expensive rate, then they may be referred as far as Tulsa, yes.
Okay, and the ones at Muskogee then are probably referred to Hastings or to another physician or doctor at a different area, right? Okay, Redbird Smith Health Center, is that the same thing with them
Yes.
primarily? Okay. Then Whimmelpy Man Killer, they would be primarily the same thing also, wouldn't they? The people at J, they primarily be referred to Hastings and then to a doctor?
I would say Jay's probably a split. A lot of those will go to Claremore as well
A lot of,
for the contract health service.
for contract health.
It depends on the physical address of the patient.
Okay. But, what you're saying there then, Claremore had 83 last month, or 43. So that's not a large number, but anyway, would that also cover Locust Road there at the AMO, Salina?
Same answer, depends on where they live. Because a lot of times, I even know people who live in Stillwell who may actually drive to see a physician at Salina.
Yeah.
So they would still be, their contract health dollars would be spent out of the Hastings budget.
Okay. And, I guess I got, of course, the Galdugi Clinic would be there. You know, a given would be no water, would they all go to
I would expect the mass majority would, yes.
and Bartlesville? Vast majority of them would go there also.
To Claremore.
And the Veneta Clinic? Were they split?
No, I would say the majority would be from Claremore.
Okay. Then what we're actually saying is that probably 85% of the people either go to Hastings or go to a physician. That doesn't involve Claremore.
85%. I'm not
Or
sure what you're
patients.
asking.
Referrals?
Referrals? The majority of the patients are referred out of Hastings.
Yeah. Okay, well, I'm trying to,
That's where most of the patients are seen.
okay. Then I'm trying to get a hold on this because I don't think there's that many people going to start. That's just me, because I don't see any numbers on it. And never have seen any numbers. But anyway, that's all I want to know. Thank you very much.
You're welcome. Thank you.
I've got one little short comment. I've been out to Redbird's original building that has been remodeled and toured it more than once, several times. And it looks like it's ready to go. They're partially moved in. We're getting really anxious. Can we have a grand reopening of that when it's?
Yes, we can. We look
We're
forward
anxious
to
for
it.
that to happen.
We are
It is
too.
beautiful. It is beautiful. So
We'll be glad to get it
you'll let
open.
us know as soon as possible date.
Yes, ma'am.
Any other questions? Okay. Thank you very much.
Thank you.
Moving right along, in old business, we have none pending, new business, none pending. Announcements. The next meeting is tentatively scheduled for Monday, June 16th at 1 p.m. We have a motion for adjournment.
Second.
All in favor of adjourn? Aye.
10-minute break.
10-minute break?
Yes.
Yes, we're third. All right.